Hi everyone, this is Ramalinga Prasad Kuppa. Welcome to my channel, Pharma World. Today's topic is designing systems and processes to assure data integrity, creating the right environment. It is important to design the operating systems and processes to assure data integrity and to create right and congenial environment for the participants in GMP arena in pharmaceutical manufacturing. Let us understand the requirements carefully and fully. Let us see the prescription of this guideline, MHRA GXP Data Integrity Guidance. Systems and processes should be designed in a way that facilitates compliance with the principles of data integrity. Enablers of the desired behavior include but are not limited to the following. We know that the integrity means honesty or sincerity in the activity being carried out in the manufacturing. So, obviously, data integrity means that data generated in pharmaceutical manufacturing is integrate, sincere, and honest. All the systems and procedures should lead to compliance to data integrity. We know the basic principles of ALCOA and its supplements ALCOA Plus and ALCOA Plus Plus. The system should be audit trailable. That means who did the job, what was done, when it was done, and why was it done, etc. Answers to this trail should be taken into consideration while designing the system and the subsequent compliance procedures. As discussed on several earlier occasions, audit trail is not only for automated electronic operating systems. It applies to manual audit trail also through paginated logbooks. There are tips or enablers to focus for this compliance. Let us see. At the point of use, having access to appropriately controlled, synchronized clocks for recording timed events to ensure reconstruction and traceability, knowing and specifying the time zone where this data is used across multiple sites. This is the first requirement. The clocks all over the manufacturing site should be synchronized. That means all the clocks should display the same time without any variation. It is recommended to have a time synchronized wall clock visible to all operators at a common place and discourage operators to use their own wristwatch timings for contemporaneous recording of data. I am sure not all wristwatches will have exactly same time. Some minor variations may be possible. Another important point is that there should not be any access for changing the time of the clock by the operator. If the operation is at different location, it should be synchronized across other sites too with specific time zones. For India, it is assigned as UTC, that is Coordinated Universal Time, plus 5.5 hours. So, if there are sites at different time zones, the UTC factor also should be considered. Accessibility of records at the locations where activity takes place so that informal data recording and later transcription to official records does not occur. This is another important point. All the necessary GMP records must be available at the location of operation. Writing on uncontrolled documents and later transcription onto the official authorized original records is not acceptable for establishing the data integrity. This reflects the bad practice. Why should any data be recorded on a separate uncontrolled paper? There is a chance for recording the data in in a favorable way onto the original record in case of any failure. This amounts to falsification of data, which is a non-compliance to data integrity concept. Access to the blank paper proformas for raw source data recording should be appropriately controlled. Reconciliation or the use of controlled books with numbered pages may be necessary to prevent recreation of a record. Most of the manufacturing activities are recorded on official blank formats in which the data is incorporated in appropriate spaces provided in the format. So it is a must that the blank formats are controlled and reconciled. This is effectively done by paginating all the formats and issue specific number of uniquely serially numbered for specific work as per the request by the user. After the issue, there should be a procedure to reconcile for the formats issued, number of formats used, number of formats destroyed, if any, for any justifiable reasons, and returned in case of they are not used further. In such controlled environment, it may not be possible to recreate another document to falsify the data. User access rights that prevent or audit trail, if prevention is not possible, for unauthorized data amendments. Use of external devices or system interfacing methods that eliminate manual data entries and human interaction with the computerized system, such as barcode scanners, ID card readers, or printers. There are 2 points to note here. One is to restrict the access rights, which is the recommended way. The other is to make the audit trail of the activity for who, what, when, and why. If it is not practical to restrict the access rights completely, barcode scanners or ID card scanners or printers may also be used to eliminate human intervention for any unauthorized changes to the data. The provision of a work environment, such as adequate space, sufficient time for tasks, and properly functioning equipment that permit performance of tasks and record of data as required. Comfortable work environment is also one of the major requirements for compliance to the data integrity. Comfortable environment includes adequate space for the operator to perform the duty, sufficient and reasonable time to make sure that the operator checks each entry carefully without error, properly working equipment with adequate high speed networking facility so that the buffering time of the data entry is not too much, access to the original records for staff performing data review activities. This is important because the data could be submitted for review immediately. Any delay in presenting the data would create apprehension or disbelief in the mind of the reviewer and can even suspect that the requested data is not available. This is a serious lapse in compliance to data integrity. Reconciliation of controlled printouts. Printouts include all weighing slip printouts, printed program files, printouts of system suitability files, etc. must be reconciled and linked to the respective activity. Sufficient training in data integrity principles provided to all appropriate staff, including the senior management. This is important. The training should be carried out from top to bottom. Unless the senior staff is trained and made them fully knowledgeable on the requirements and the repercussions for not complying to data integrity compliance, entire exercise of training will be a waste of time. This should be done in word and spirit. Compliance to data integrity should be like following a cultural tradition which runs in the bloodstream. No shortcuts. So, the quality culture should improve to comply to the data integrity compliance. It should become heart and soul activity for compliance to data integrity. The evaluation should also focus on the cultural and attitudinal aspects of the participants. Inclusion of subject matter experts in the risk assessment process. The subject matter expert should have a comprehensive understanding of the requirements of quality risk management guidelines ICHQ9. They should have complete understanding of all quality risk tools. They should also know where to use FTA tool, FMEA tool for qualitative evaluation and FMECA tool for quantitative evaluation. The usability and features of other tools like HACCP or HAZOP, PHA, risk ranking and filtering should be understood well. Risk assessment data should be evaluated by statistical tools including Six Sigma, standard deviation, X bar graphs, moving range graphs, scatter diagrams, or Pareto charts, etc., to name a few. Management or oversight of quality metrics relevant to the data governance. Quality metrics are quantifiable measures used to assess the performance, effectiveness, and overall quality of the product, process, service, or system. Quality metrics on data governance provide objective evidence that can help organizations understand how well they are meeting their goals and standards. Quality metrics are crucial in pharmaceutical manufacturing. The use of scribes to record activity on behalf of another operator can be considered where justified. This is a situation where the data is recorded by someone else for the activity done by the operator. Certain continuous operations where any break in system for recording the data needs a changeover of clean clothing and takes some time for recording. The recording can be done by another person witnessing the activity. This is prevalent in manufacturing of many sterile dosage forms. Also, the controlled environment may not allow to record by the operator directly while carrying out the activity. The act of contemporaneous recording compromises the product or activity. Example, documenting line interventions by sterile operators. So, this is the point. The recording activity where scribe can be assigned should not compromise the operation. Necropsy, GLP. Necropsy is a surgical examination of a dead body, commonly a dead animal, to find out why the animal died. It is like autopsy. In such situations, also, a scribe is generally used to accommodate cultural or literacy language limitations. For instance, where an activity is performed by an operator but witnessed and recorded by a second person. This is another important aspect. When the operator does not know the language in which the transactions are happening, such scribe who will witness the activity and record contemporaneously. The guidelines prescribe that in these situations, the recording by the second person should be contemporaneous with the task being performed, and the records should identify both the person performing the task and the person completing the record. The person performing the task should countersign the record wherever possible, although it is accepted that this countersigning step will be retrospective. I hope that the intent of this section of this guideline is understood well. Important point to note is that the compliance to data integrity should be a part of quality culture of the organization from the top level to the bottommost levels of pharmaceutical manufacturing. This commitment for compliance to data integrity should run in the bloodstream culturally. All the controls as described in this section must be captured in a detailed policy or an SOP. The process for scribe documentation completion should be described in an approved procedure that specifies the activities to which the process applies. The scribe could be the next supervisory level person. Thanks for watching. For more videos, please do subscribe, like, and share. Also, please leave a message in comments box for any further support. Thank you.